Hello viewers and welcome to my channel. My name is Dr. DR.KOITATOI and I do this channel to give an awareness on general medical conditions that affects us. And today we'll be looking at high blood pressure along with its complication commonly known to be stroke and heart attack. I create this awareness and link it to our faith in Jesus Christ, because the Bible encourages us in the book of Ecclesiastes chapter 7 verse 12 that wisdom is shelter and as money is shelter. But the advantage of knowledge, of course, above money is that wisdom preserves those who have it. This is a wise saying from Solomon, one of the wise people that we have encountered in the Bible, encouraging us that we need to have wisdom. We need to have knowledge because knowledge will preserve you. Wisdom will protect you and sustain your life. So, in as much as we have our faith in Jesus Christ, it's our obligation to have an understanding and knowledge about our life so that the knowledge that we get can protect us and sustain our life. We are able to walk with wisdom, we are able to seek health care with understanding, and we are able to take care of our bodies, which again the Bible says it is the house of the Holy Spirit. So, what is blood pressure? Blood pressure is essentially the pressure of blood in the vessels, in the blood vessels. So that's why we would tie a blood pressure machine on either the hand or the leg to assess the pressure. We are always looking at, so pressure is pumped from, blood is pumped from the heart, as you see in this animation. Blood is pumped from the heart through these vessels, and then that pressure, the force of blood as it is moving along the vessels is picked along these vessels, the red ones called the arteries. Now, it can be similar to what happens to water in the pipe. So this pipe is releasing water, and even as you hold the pipe, you can tell the pressure of the water in the pipe. If the pressure is so much, the pipe will be vibrating, and you would feel even like the pump could rupture, could burst. Also, if the pressure is too high and you point it at a leaf or a branch of a flower, it can break off that leaf or that branch. And if you point it on the ground, if the soil is loose, it will drill a hole in that area because of a high pressure. Similarly, the pressure in the blood vessels would also have an impact on the organs that the blood is going to: the kidneys, the brain, the heart, and essentially every part of the body. So, again, the worst scenario is when this vessel, which has already a high pressure, is blocked. If it is blocked, then it has a tendency of rupturing. Now, if you see this other animation, it again depicts how blood flows in the vessels. If the vessels are wide enough, then blood is not in so much pressure. If you're using a pipe that is a bit wide, then the pressure of water in that pipe is not very high. But if the pipe is narrowed, then the pressure becomes high. So look at this artery. Look at that artery. Yes. This artery on this side, I think it's on the right, is now narrow. This one is now narrow. So the pressure of blood here is very high, and it can cause damage to that vessel or to that pipe in this case. Now, what is pressure? Pressure is force exerted to the walls of the vessel by the blood flowing through it. So as blood is flowing through the pipe or the vessel, it's exerting pressure into the walls of the pipe. And if the walls are weak, it can rupture. And if the walls are not even weak, usually it corrodes inside, like erodes them, or makes them so hard. A process called arteriosclerosis makes the vessel so hard and resistant. So, if it is high, if the pressure flowing through that vessel is high, it's called hypertension. Okay. Then it's usually a very serious health condition. A very serious health condition because blood visits every single cell in the body. And as blood visits every single cell in the body, it has to visit with calmness and not under pressure. If it visits under pressure, it has a tendency of damaging those cells, be it in the kidney, be it in the vessels themselves, be it in the brain. And if it persists for a long time, it will cause those injuries, and thus this is usually referred to as a silent killer, because the injuries that it causes slowly by slowly are usually painless. The unfortunate statistics here is that 30% of the global population aged between 18 years to 69 years are hypertensive. They have high blood pressure. Unfortunately, those who are hypertensive, only 30% of them are aware that they are hypertensive. So, a whole 70% of those who are sick are not even aware they are sick. They do not have themselves tested for blood pressure. Another unfortunate incident here is that only 6.5, only around 7 people out of 100 of those who are aware and those who have visited the doctor, only around 7% have their pressure optimally being managed. Most of them are not compliant to medication. Most of them have visited the doctor once and they have not gone back again. Those are the challenges. Blood pressure is usually recorded in two numbers, a fraction of a number on top and another number below. The number on top implies, look at this. This animation illustrates the heart beating. So when the heart is contracting, it pushes blood out of the heart to the vessel. So basically, when that blood that is in the heart is pushed through the vessel, the pressure is high. The pressure is high in the vessel because a lot of blood has been pumped through. So during that contraction, so when the heart contracts, then the pressure is high. So during the contraction, we pick a pressure that is high, and usually that pressure is called a systolic pressure, and it's put on top, and it's usually the pressure during a heartbeat. Now, immediately after the heart has contracted, it relaxes. Then when it relaxes, the pressure would go down even in the vessel, because less blood is flowing. When you feel your heartbeat on the arteries of your arm or of your hand, you'll always feel the heart beating. So at that point when the heart is beating, blood is more in the vessel and the pressure is more. And then when the beat disappears, that means the blood is less. It is still flowing but at a lesser pressure. So during that relaxation, that one, that's relaxation. So this relaxation, when the heart is relaxing or bulging outwards, then when the heart is relaxing, then the pressure is lower in the vessel that we pick using the BP machine, the blood pressure machine, and that pressure is called a diastolic pressure, or the pressure between the heartbeat, and it's usually lower. Okay, however, both readings are important, and let me take you through the normal the blood pressure ranges with regards to high blood pressure. If the blood pressure is below 120 over 80, so the upper figure is below 120, the lower figure is below 80, that is the perfect normal blood pressure that is desired by every cell and every organ in the body. If the blood pressure is elevated, that you have a limit of, on the upper figure, you have the blood pressure above 120 up to 129, and on the lower side, it could be less than 80. That blood pressure is elevated. It is not harmful to the body, but it is said to be elevated. Guidelines have been revised to give the healthcare providers sensitivity of picking this high blood pressure, so that we are able to warn our patients even when the blood pressure is at this point, when it's essentially normal. We would fear that this guy can progress here, and we will just pass a piece of advice on what changes you should make in your life. But you are not hypertensive at this point, but the blood pressure is elevated. In fact, this is the blood pressure you should pick when you run, when you exercise. This is the blood pressure you would pick at that point, and usually you are advised, even when you want to take your blood pressure, take a 10-minute rest and then now take your blood pressure, so that we pick a blood pressure preferably at this level after you have taken your rest. Now, what about if the blood pressure is 130 to 139 on the upper figure, and the lower figure is between 80 to 89? That person is said to be hypertensive. Okay? That person is said to be hypertensive. So screening is now very sensitive to pick high blood pressure. Now, if this person is hypertensive, he is not yet eligible to start medication. So he's said to be in stage 1 hypertension. The doctors would counsel you and advise you on changes to make in your lifestyle, food, exercise, and several other changes you can make, responsible lifestyles, so that you avoid progressing forward to stage 2. Stage 2 is when the upper figure is reading 140 and above. The lower figure is reading 90 and above. Okay? At this point, you will need to start medications. Okay? You will need to start medications. I remind you, if you are in stage 1, the doctor may not start you on medications. But if you have other conditions like diabetes, a thyroid problem, or high cholesterol, the doctor might recommend to start you on medications for high blood pressure. It won't harm, it's for your own good, to avoid long-term injuries to the body cells and the rest of the body organs. Now, if you are at 140 plus on the top and over 90 on the lower figure, then you definitely have to be started on medications. Okay, now this is the extreme. This is the extreme. If your blood pressure is at this point, usually when the doctor picks that, and that's why blood pressure is the first thing is tested when you visit any health facility, because it's something that can cause can change from a normal person to an urgent medical emergency. So if it is picked that it is here, usually the healthcare providers are worried for you, and you will be given the appropriate information and management. Now, how do we diagnose high blood pressure? High blood pressure preferably is diagnosed with at least 2 readings, especially when you are getting readings of 120s, 130s, and 140s. The healthcare providers would prefer to take your reading twice. Of course, when the readings are very high, they will repeat, but usually that is very concerning. But if the readings are between 130 and 140, it's usually advisable to get 2 readings if you have visited a healthcare facility, and at 2 different settings, like you take and repeat after a few minutes, so that we are able to pick what is happening with you if you are truly hypertensive. Now, best readings to depend on are usually home readings. It's advisable to have a blood pressure machine at home. You don't have to be a medical provider. You can buy that in any pharmacy and take blood pressure readings at home. Now, these are the readings that we normally pick in the facilities. So we pick this kind of readings. So the first one is a perfectly normal reading of blood pressure. The top figure is below 120, the lower figure is below 80. This one is normal but elevated blood pressure. Okay, it's said to be that so that we are cautious about our health. Now this patient is hypertensive. Okay, I've put that figure as low as it is 32, and you can even see with this kind of machines that have got these color calibrations, it puts it at this point. Okay, you are hypertensive at this point, and see that the lower figure is normal. Okay, I told you both figures are important, and the figure that is higher than it is normal is usually used by the providers to stage you and tell you whether you are in first stage or second stage or in a hypertensive crisis. Okay, so when you come to this one, this patient is in stage 2 hypertension. Okay, stage 2 hypertension. What about this one? This one is in a hypertensive crisis. The pressure is too high. The pressure is too high, and the cells of the body cannot tolerate this for a long time. Okay, what are the complications for hypertension? I look into this under long-term complications and short-term complications. So we start with the long-term complications. Why do we start with long-term complications? Because as we develop high blood pressure, normally most patients will be in these readings, 140/90, second stage hypertension, for a long time without seeking health care, no pain, nothing. But what is happening at this point? At this point, we are having an injury to the eyes and we lose vision. Okay? We can have small injuries to the brain. We can have injuries to the heart slowly. I will show you. And then we can also have injuries slowly to the kidneys. Now look at this diagram. So this diagram shows us that we have what we call hypertensive retinopathy, failure of vision, failure of the retina. The retina in basic biology is usually the part of the eye which now picks the image of whatever you are looking at. So the image will go through the eye, the light rays will go through the eye, and usually at the retina here, the image is formed. Yeah, the image is formed. Now, how does this retina look like if you look from the front? So when the doctor examines your eye from the front, this image here is from the side. Now what you're looking here is from the front. Now if the doctor examines from the front through the pupil, they see the retina like this. Now these are very many blood vessels and they are very tiny. At this blood pressure, these tiny blood vessels are already suffering one by one. They bleed, they get obstructed, some of them will get occluded again, same way, and the retina dies. The retina dies. Look at those white spots. The retina will die. Now, if the retina dies, you lose vision, and it's not because you are getting old, it's because pressure is affecting your retina. Now, look at this other diagram. This is the kidneys. Now, what happens to the kidneys? You see that this is a normal kidney even from outside. And this kidney is smaller in size and it's dysfunctional. It's not filtering out urine as normal because it's dead. It's dying, okay? It's dying. The small functional units of the kidney called the nephrons have very tiny blood vessels, much as small as those ones in the retina. So they are also suffering even at this blood pressure, even at that blood pressure. They rupture, they get occluded or blocked, and the nephrons die, and the kidney starts shrinking like that. The kidney starts shrinking like that. Another diagram. This is on the heart. Long-term effects of high blood pressure. Long-term effects of high blood pressure. So what high blood pressure does over time? This is a normal heart. Okay, this is a normal heart. Over time means when the blood pressure is even at 140/90. Now, if the blood pressure persists being high, then the left ventricle, usually the chamber of the heart which pumps blood to the rest of the body, it's pumping blood against resistance of the arteries. Remember we said the arteries become narrow and resist blood flow. giving blood a lot of pressure. So the chamber of the heart that is responsible to bring blood all through the entire body is now being overworked, and then that chamber becomes thick, very thick, very thick. And as time continues, it starts now becoming tired. It starts becoming tired, and suddenly it becomes floppy, and opens out like that, and it loses now the force of contraction. It loses force of contraction, and you get what we call dilated cardiomyopathy. The heart muscles are now weak and paralyzed because they have overworked for a long time. This stage is now called heart failure. Yeah, this stage is now called heart failure. So at this point, this is now called heart failure because the heart can't contract now strongly. Yeah, the heart can't contract strongly. Now, this is an actual image of a patient who had very high pressures. Now look at that thickness. Look at that thickness. Very thick, very thick. Very thick. Look at the space of the chamber. The chamber has been reduced. So this heart has had high pressure for a long time, and it was about to go into heart failure. This one had not gone into heart failure. Of course, this patient didn't survive. That's why we have these images. But now I will show you what caused the death of this patient. Yeah. So now, what are the risk factors of high blood pressure? There are things that we can't do anything much about them, and this is age. Yeah, just as you grow older, remember, high blood pressure is the normal physiology. Pressure is the normal physiology of the body controlling it. Yeah, when you run, the heart rate goes high. When you sit down, the body regulates it, and the heart comes down. But you see, because there's a normal physiology of the body that we don't even control it ourselves. Even your body, you don't even know what it should do at any point in time. Okay, it's automated. If that system fails, and usually it has a tendency of failing with age, then these things can set in high blood pressure. Okay, high blood pressure. So the older you grow, the chances increase of developing high blood pressure. Okay. Now, sex. Men have been noted to have high tendencies of developing high blood pressure than women. Family history. When the doctor is asking for any family history of high blood pressure, they are not implicating to any cases. They are not implicating to any religious breakage of the law. They are not implicating, no, because genetics has a predisposition to developing high blood pressure. Remember, I said it's the normal physiology of the body that fails. Okay, and just like you resemble your father or you take after your mother in the external appearance, that is the same thing in the cells of the body inside and the organs inside. Okay, so if the parent had a tendency of developing if the parent had developed high blood pressure at a certain age, okay, the son and the daughter have to be very cautious, very careful not to develop, because it does not mean that the father had wronged anybody, does not mean that it is an inheritance of a curse or something, but it is the physiology of the body that wears out over time with age, and it has a genetic predisposition. Okay, it has a genetic predisposition. Now, what are the things that we can do? We can do something about. Remember those factors here. We can't do anything much about them because we are our parents, sons and daughters. We are male or female determined naturally by God, and age also has to progress naturally. We can't do much about that. But now, what about such things like you using a lot of salt? Using a lot of salt. That is a risk factor of hypertension, and you can do something about that. What about not using vegetables, doing a lot of carbohydrates only? That is your own decision, and you can do something about that. What about having so much weight? Some of it is quite implicated with families also, just being having a big body, but obesity you can do something about to reduce your weight. Okay, what about having a physical inactivity, or what we call sedentary life? You are just so seated, you're just so calm, you don't exercise, you have to be able to do something about that, okay? Because this is very, very dangerous for your life. Also, you must be very active. You must be very active. If you have some other medical conditions, diabetes mellitus, high cholesterol, a problem with the thyroid hormone called thyroid issues, or high thyroid hormones, then you can do something about those medical conditions, also to prevent the development of high blood pressure. Okay, what about if you are using cigarette? That is your own decision. It's not a family issue. You can do something about it. If you are taking tobacco, it's not a family issue. You can do something about it. If you take alcohol, it's not a family matter. It's not an age factor. You can do something about. Okay, psychosocial stress, you can also do something about managing stress, work stress, family stress, social stress. Okay, now what are sudden complications of high blood pressure? I talk about this because they are the main causes of sudden death in the families. And when you visit a doctor and the doctor asks history of sudden death, we ask that because sometimes people don't know if the parents have had high blood pressure, if the parents have had diabetes, if the parents have had these chronic conditions. They only report of sudden death. Okay, sudden death comes from sudden complications from high blood pressure, and high blood pressure can give us what we call stroke, also called brain attack. Okay, and another one called heart attack that we shall look at. Now, how does it give us? It gives us brain attack, because the brain has got so many blood vessels taking blood to it, and nutrients and oxygen. Okay, any of these blood vessels can be affected, and mind you, somebody can suffer from paralysis of one side, so-called stroke. Okay, and somebody can suffer from death, sudden death, depending on which blood vessel has been affected here. If this one is affected, this one seems to be on the outside part of the brain. These ones are in the inside center of the brain. So the more inside they are, the more dangerous they can cause a life-threatening implication. Now, if you have these many blood vessels, any of those blood vessels is at risk of being affected by blood pressure. Okay, blood pressure. So stroke and brain attack is when a part of the brain is stopped from receiving blood. Okay, this blood is supposed to take nutrients and oxygen to this part of the brain. Okay, look at this other image. Okay, so these blood vessels are taking blood to the brain. Yeah, they go very many, they divide and become very many, so that all the areas of the brain is supplied with blood, and this blood is carrying oxygen, the nutrients, and all manner of chemicals that are necessary. What about if you block this blood vessel? What about if the blood vessel ruptures and bleeds like this? Then the area that was supposed to receive that blood suffers, okay? And that part dies off, and it's called stroke. And depending on the area that has been affected, you can get an injury that is not compatible to life and somebody dies instantly. That one is called brain attack, stroke. Okay, or you get an injury from one of the vessels. You just get a severe headache, then you get paralysis. Over time, you are not able to control. You lose power in the one side of the body, and that one is called paralysis. That as well as has been brought about by stroke. Okay, now look at these pressures. These are the pressures that really bring about this. At this point, normally when you walk in and a doctor sees the pressure being at this point, it's usually very concerning, very worrying, and we are worried about your life. Okay, look at that bursting of the blood vessel. Okay, now look at this actual photo. This is an actual photo available online. So if you look at this patient, this is a brain that has been cut through by a doctor who is trying to establish what has killed this patient, because most of the time these patients die without any symptoms prior to the illness. It's just a sudden death. You could die just at home, you could die just in the car, like that. Okay, why would it so why would it cause death? Because look at where the area of the brain that has been affected, inside the brain, at the middle of the brain, you get a vessel that ruptures and bleeds. Then this bleeding now causes pressure, so much compression of the rest of the brain, and this one is not compatible to life. You cannot survive one cannot survive such an accident. We call it a cerebrovascular accident. We call it an accident of the blood vessel. Either the blood vessel has ruptured accidentally and then causes that large bleed, and this person, such a person, is not usually able to survive that. Now, what about this one? This one is a bleed that has occurred at the lower part of the brain. Look at that big clot. This is a big clot of blood that had occurred at this part. This part is called the cerebellum, or the little brain, which usually sits on the lower aspect of the brain. This is the brain, yeah? So it sits here. So if it sits here, it is very close to the origin of the spinal cord. So this bleed had pressed the spinal cord, hence causing instant death or sudden death. Now, what about a situation whereby a blood vessel is blocked by a clot? Yeah, because of high blood pressure, a clot can form inside the blood vessel, okay, and then it blocks the blood vessel. If it blocks the blood vessel, we don't get a bleed as in this case, but the area dies because the blood has stopped reaching there. It's like when you tie your finger, give it some time, the area that now you've cut short blood from arriving, it turns out to be black, okay, and dark, and it dies off, okay. That is what happens if someone literally ties a ligature or a rope around the neck. If someone commits suicide and ties a rope around the neck, now that blood stops reaching the head, and then the brain dies. That is the same case. That is a similar thing that is happening in this image. Now look at this one. This is an actual photo where someone succumbed or died from a stroke that was not a bleed, but a blood vessel had blocked because of high blood pressure and other factors like cholesterol, as we shall see. Cholesterol is the biggest implicator in this case. Yeah, we shall see that cholesterol. Very sad, very unfortunate. This black part is the part of the brain that has died. Okay, now what about heart attack? Similar things, similar story, but now this is happening in the heart. Okay, blood vessels that usually go around the heart also to feed the heart with oxygen and the required nutrients. Okay, now what happens if you have a blood vessel that is blocked? If it is blocked completely, and the blood vessel is very important to the heart, because it also depends on which part of the heart that has been blocked. Yeah, and also let's say, for example, you have these blood vessels that are going to this side of the heart. You have others going on the other side. Yeah, then normally there is one of the blood vessels that supplies a very important part in the heart, which regulates the heartbeat. Okay, now if that particular coronary artery is affected, now usually that particular heart attack is not compatible to life. Okay, in this case here, this one here could be, you could survive this and just have what we call severe chest pain, also called angina. Okay, angina. Now look at this one. Look at this. This is a small video illustrating how heart attack is serious. Yeah, how heart attack is serious. Now, sorry, sorry. This one here. So if you have this one here, look at that. Someone was going about his own business. Sorry. Someone was going about his own business, withdrawing money in an ATM, and heart attack strikes. Very, very, very unfortunate. Very unfortunate. Yeah? Very unfortunate. See that? Yes. Very unfortunate. Very unfortunate. So sad. Okay? Now, so this is what we're calling an atheroma plaque. A plaque is this yellow thing that's a combination of cholesterol, sugar, and some blood cells. Yeah, they progressively grow and make this blood vessel narrow. Yeah, narrow. So it starts like with this one. No, this is a normal blood vessel. This is a normal one. That's how it should be. Very open. Blood flows freely. Now, if you have this yellow thing uh, blocking the heart, blocking the blood vessel, it can start with blocking and not blocking completely. So usually at this point, you get angina, okay? You get angina. Now, angina is when you have chest pain with exercise. When you run, when you exercise, then you get chest pain. That means there is a blood vessel in the heart that is usually blocked halfway, and during exercise, blood cannot go through it at the rate at which the heart now requires that blood, yeah, because it is not able to compensate the flow of blood, yeah. So now some part of the blood, some part of the heart now feels like we are deprived from blood flow, and it elicits a lot of pain as it dies off. If it is completely blocked, then usually it leads to heart attack and sudden death, depending on the side that has been affected. What are the risk factors of stroke and heart attack? Again, just like high blood pressure, the same factors that will lead to high blood pressure will also lead to stroke and heart attack. Yeah. So there are those that we can't do anything about: age, sex, and family history. Again, family history. Please, family history. Just we learn from the past. So if a relative has had such a problem, we ought to be very cautious. Yeah, we ought to be very cautious with our lifestyle. Now, what can we do about some things? Yeah, hypertension, high blood pressure itself, we can control. Other comorbidities like diabetes, we can control. High cholesterol, we can reduce. Obesity, you need to do something about reducing the body weight so that your BMI is less than 25. Physical inactivity, you are not active, you can do something about that. Okay? Cigarette smoking, tobacco, and alcohol, you should be able to do something about that. Completely stop cigarette smoking, stop use of tobacco, and stop use of alcohol. Okay? Now, this is again another image showing us how the cholesterol is implicated in heart attack. So, look at that vessel, very nice and wide open. This one, a cholesterol plaque, along with sugars in it, have started blocking the blood vessel, and suddenly it can cause a blood clot in it and blocks the blood vessel suddenly. Now, sedentary life, a life whereby you are not active, you work from home, you are seated for almost 24 hours of the day, you are not active, it's very dangerous to your life. So working from home, and look at this patient, this person he also still has this central obesity, very dangerous life aspect. Okay, smoking has also been implicated, like we've said. Now, how do we prevent these things? How do we prevent this medical condition? There is what we call a DASH diet. A DASH diet is an appropriate diet to stop hypertension. So it's said to be diets approach to stop hypertension. Dash. Okay. There's a table here. You can pause the video and go through it. Vegetables, fruits are good for your health. Whole grains are good for your health. Low fat dairies like milk, but it has to be low fat. Fish are good for your health. Poultry are good for your health. Beans, groundnuts, and other seeds. Vegetable oil are good for your health. The things you need to avoid, please, I'll start from here. Salt, table salt, table salt. Please minimize the amount of table salt. And then this one, sweets and the beverages like sodas, the increased body weight, and then full fat dairies also increase the presence of cholesterol, and then fatty meat also increase the presence of cholesterol. So all these ones, please limit the use of that. Limit the use of that. Another thing is, like I've already mentioned, body weight. Make sure that's below 25. BMI is below 25. Okay. Physical exercise. It's recommended you have 30 minutes every day. A brisk exercise that makes you sweat. Okay. Stop alcohol. Stop smoking. Stop tobacco. Please. Another image illustrating how we can utilize an appropriate diet. It's the same thing here. How we can utilize appropriate diet to stop hypertension. Okay. Now, how do we prevent complications of hypertension? Early diagnosis of hypertension is very paramount, early, because if you're coming in and by the time you are being diagnosed, your pressure is at 160, probably we have already suffered some heart injury, some kidney injury, and some eye injury. But if you come in early, and that is enabled by having a machine at home. If you can test your blood pressure at home, it enables us peak blood pressure very early on time. Now, another thing is regular checkups with the doctor. Regular checkups with the doctor. Cholesterol levels. We have to test cholesterol levels and bring them down as much as possible. We also have to assess your kidneys so that we are monitoring and making sure that the kidneys are not being damaged. Glucose levels. Having high blood glucose has also been implicated in causing strokes and heart attacks. Yeah. ECG is an assessment of the heart where the doctor looks at your heart and tries to assess if there is any heart injury from high blood pressure. Okay. Compliance to medications is very much called for. Compliance to medications is very much called for. High blood pressure medications are medications to be used for as long as you are alive. Okay. I will say that, and it's usually information that many clients don't like to hear. High blood pressure medications are medications that will be needed to support and control blood pressure for a lifetime. All that can be done is continued monitoring and altering dosages along with your doctor. Okay, along with your doctor. It's a lifestyle disease. It's not a disease that you received like malaria from someone and you need 5-day treatment to stop to get healed. Hypertension has no cure because it is not an infectious process. It is a lifestyle disease which has resulted from failure of a natural physiological process. Okay, so you need control over your blood pressure for your lifetime. Okay, now, and when you are taking blood pressure medications, you don't just take because the doctor has recommended you take. Aim at what we call optimal control of your blood pressure. Okay, optimal is get appropriate. When I test your blood pressure when you're on blood pressure medications, you should not show like you have blood pressure because your blood pressure should be normal. That's why you're on medications, to make your blood pressures normal. We target systolics or the upper figures less than 130, the lower figures less than 80. Okay, and if you have diabetes at the same time, please control the blood sugar. If you have cholesterol, make sure that they come low. And that's why many times with high blood pressure, we recommend you also on medications for cholesterol. Okay, now home screening is very much called for. Home screening is very much called for. This machine is sold at about 3,000 to 5,000. Every household can have one. Every household can have one and use it at any time to assess your blood pressure so that we can pick this early. Okay, and remember the ranges. Your blood pressure must be very normal, below 120 on the top figure and below 80 on the top figure. At this point, please be cautious. Reduce your salt intake, reduce your cholesterol, reduce your sweets and glucose intake. Okay, and such like that. Okay, also look at the DASH diet. Thank you so much, and that's all about high blood pressure, stroke, and heart attack. With knowledge, we can sustain our life. Okay, if we are not knowledgeable, we can suffer from sudden death. Okay, we can suffer from long-term implications of high blood pressure. Okay, so I call us to have an understanding and knowledge of these problems so that we can save our families and we can save our loved ones, because the Bible also urges us to take care of our loved ones. And those who are hearing this, please subscribe, please follow, and share the video. Okay, you can also comment on what you want me to talk about in the next video, and God shall bless us, all of us together. Okay, thank you so much, and be blessed.